We've been doing a 4-part series on things that are called common factors, the things that make therapy work. And the last one is hope. 15% of what makes therapy work is hope. And can your therapist help you to see that your situation can change? Do you believe that the process is going to work? They call that placebo. We call it hope. Call it what you want. What we do know without a shadow of a doubt is that it works, and it's important.
There are times in your life when you're going through a difficult situation that you may not be able to see or even think about trying to look for the positive things that are already in your life and how much you've already been through and that you can come out of. Knowing that you can come out of this and being told that you can come out of this with evidence and someone that can instill that amount of hope in you, I mean, that's something to look to and to be encouraged by and to just want to be around.
Yeah, I think hope is just like despair, or I like to look at it as lenses that you see life through. Whenever somebody gives you hope, it's a new perspective that you might have been seeing life through despair and destruction, and then you go talk to somebody and they point you in a different direction and they say, well, what about this, or what could it be if it was this, or what does this really mean? And they start asking questions, and all of a sudden you see yourself looking through a different lens of hope instead of despair. So a lot of this has to do with the way you think as well.
One of the opposites of depression is hope. Whenever you're looking forward and you believe that your situation can change. In fact, a good therapist from time to time is going to have hope for you and while you're developing it, while you're starting to trust and grow. And sometimes you meet a therapist and you hear the way they talk, you hear their confidence, you hear their skill set, and it gives you confidence that something can change. Because, well, if you don't believe things are going to change, counseling is going to be impaired by that. And sometimes you have to bring hope into counseling with you.
Not knowing what to do to help yourself get out of a situation or out of a pattern of thoughts or a state of mind that you're in, there's hope whenever you gain those skills to be able to work through that stuff yourself and to know, okay, I've got someone who is on my side and who wants me to get better and wants to see me do well and succeed, and they're giving me these skills to be able to take them into my daily life without them and to succeed.
Yeah, I think encouragement is a big a byproduct of hope. I mean, whenever we give hope to somebody, they feel encouraged automatically. And then that's one thing that's important that I make sure I do in every counseling session is whatever we talk about, I encourage them at the end, tell them that they're going to do this, everything's going to be awesome, they're going to make this work. And I'm trying to instill that in them, trying to be a competing voice to the negative voice of despair that they've been hearing for quite some time.
Maybe you need a little hope. A little hope to borrow while you're getting your own, or maybe you need some practice in how you can develop hope in your life and in your situation. Feel free to give us a call, and we'll see if we can't find places and ways to join you in what you're going through. Walk beside you, maybe look at things a little differently, maybe apply some empirically sound practice, and see if your change is just around the corner.